safety is anesthesia, more than anything. There are probably 11 slides, 6 of them are anesthesia. And this is a talk on joint replacement. Why are 6 on anesthesia? Because it's safety. You don't want the risk of death or permanent injury. And we talk about what you don't want to do. It's the same in spine. It's the same in everything in orthopedics. You don't want to do certain things. Number one, when you're in our operating room, you should never stop breathing. If you come into our room and you get a general anesthetic, the first thing that happens is you stop breathing. You're paralyzed. We say if you stop someone from breathing on purpose, at the end of surgery, you have to wait for them to breathe again. Does that make sense? Does anyone think that's better than breathing continuously? So, anesthesia is first. Never stop breathing. Don't do general anesthesia for hip or knee. Number 2, never put a tube through someone's vocal cords and inflate it when they could have been breathing through a mask. No intubation. Mask. Number 3, what's coming through that mask? Do you want to breathe pure oxygen? It's a choice. Or do you want to breathe an anesthetic gas? I don't think you ever want to breathe an anesthetic gas. It's absorbed into fatty tissues and it continues to come out of your body and live in your body after the surgery is over. You can't get up and walk. You can get blood clots because you don't get up. It could lead to death. Choice of anesthesia could be life or death. So, again, choices. We're still on anesthesia. Which is better, mask or tube? On the left, gentle hands, oxygen pouring through the mask, the patient's breathing on their own. On the other side, look at that metal blade. You're going to look through that thing with a light, pass it through the vocal cords so you can inflate a tube and hook someone to a respirator machine that breathes for them. Did you know you have a choice? When you have joint replacement, you get a choice. You don't have to have that. And they pass that down your throat, or they could pass the soft mask into your mouth. Which is better? Number 2, the trauma of the choice. In one room, you have a tiny needle puncturing the skin. That's your package for your anesthetic. That's how they do it. In the other room, you have a man or a woman with that big blade looking down your throat. We say we want package number 1, a little needle going into the spine, a spinal anesthetic. Again, a soft mask or a hard blade in your mouth. Never put that blade through there if you don't have to. Now, once you put that needle in the spine, what are you putting in there? Lidocaine, short-acting spinal, may last 3 hours at the most of numbness and not moving the legs. Lidocaine has a very short half-life. In 90 to 120 minutes, half of its function is gone. Then propofol is the anesthetic that we use instead of a gas. You drip it. As soon as it drips in your body, you sleep. But it's the only anesthetic where you sleep and you breathe on your own. You're asleep and you're breathing. If you do general anesthetic, like I said, they're paralyzed. You stop breathing immediately, and the respirator breathes for you. So with regional anesthetic, you don't breathe gas, you breathe pure oxygen during your entire operation. If you breathe that gas, look at the half-life. 15 to 24 hours, half of it is still functioning in your body. That's why you won't get up and walk. That's why you get sick. That's why you're dizzy, your blood pressure's low. That's why you can't walk and get blood clots. We want you to bounce up right after surgery the same day like it never ever happened, like surgery never happened, and walk. One other benefit of epidural or spinal, regional instead of general, when you put that in, the vessels relax, the veins dilate, they're bigger, they have less pressure, so you bleed less. The choice of anesthetic affects how much you bleed. It affects how much you bleed. And since the vessels are open and the blood is flowing, lower risk of blood clots. Wow, we just talked about anesthesia. We haven't talked about surgery at all, and it's already safer.